It's been 3 years since the GLA Gala was in person here at Cipriani, and looking around this room, it's great to feel inspired and hopeful. Yes, Lyme and other tick-borne diseases are a daunting public health threat, as you'll hear more about that later tonight, but with you as allies, I have no doubt that we are embarking on an era of unprecedented progress. As interim CEO for much of this year and chairman of our board, I've gained a somewhat unique perspective about what makes GLA such a vitally important organization that has accomplished so much in its relatively short history. Donors should find comfort in knowing that we are a lean operation, and all of our work is carried out with a focus on getting the most out of every dollar we receive from people like yourselves. And our accomplishments stand as a testament to the faith that many of you have placed in us. For example, GLA funded the discovery of the first new drug in over 30 years to treat acute Lyme disease without damaging the good bacteria in our gut. It's now being developed by a biotech firm currently going through the preclinical trial phase. By the way, about 70 to 80% of our immune system is found right in our guts. GLA has funded research that demonstrated in a study of 86 Lyme disease patients that both the Lyme infection and broad-spectrum antibiotics like doxycycline really damage the good bacteria of our gut microbiome and cause inflammation throughout the body. Next year, we will have a larger study of 500 patients conducted by Flightpath Biosciences and supported by GLA, which will test that new drug, hygromycin A, to determine if it spares the good bacteria in the gut while killing the Lyme bacteria. GLA has also funded development of a much more specific diagnostic test for a deadly form of babesiosis and may have a path toward a vaccine for this parasitic infection that so many with Lyme also contend with. And we funded research that discovered a way that the Lyme bacteria can evade the immune system, much like cancer can. And this can lead to new ways of eliminating the Lyme bacteria. We are proud to be working with Dr. Howard Robbins, who is here with us tonight, in examining how ozone therapy is helping Lyme patients, and we encourage you to follow us and stay tuned for some very interesting findings. Lastly, GLA has also funded development of the most promising direct diagnostic test for early Lyme disease. Imagine, if you will, a more accurate test for all of us, but especially our kids. But we really need additional funding to commercialize it. Research is very expensive, and that costs about $450,000. For many of you here tonight, the disease has affected you personally or stricken a member of your family or a close friend. I have never been comfortable sharing my story because, frankly, I don't really enjoy talking about myself. But as a member of the GLA family for more than a decade, I've come to learn from the very many ill people I've spoken to over the years that briefly sharing my experience with them almost always makes them feel better because they recognize he gets it, he knows what I'm going through. And of utmost importance, I could assure them that it's possible to get well or well enough to live a life very much worth living. It was 18 years ago I became ill, and after 25 doctors, including 11 at the Mayo Clinic, after 16 months, I still had no answers. At that point, I was an invalid and recognized that my career was likely over, and that did turn out to be true. But however, unlike many, I was so very fortunate to ultimately find the right doctor who figured out what was wrong and could begin to treat me. It's taken 18 years, but for the past 17 months, I now have many more good days than bad. Many, perhaps most of you, have such stories. The facts may differ, but the dynamic is the same. We're moved by the need to make a difference so that others don't experience the same fate. I am inspired by witnessing the way in which many of my fellow board members have turned their personal battles against Lyme into a larger calling and to provide every person who suffers from this disease a better path. Many of them could have simply moved on, pursuing their own goals without much concern for the plight of others, but they did not. Canadian author Robin Sharma has written, "Good health is a crown on the head of a well person that only a sick person can see." Most of you here tonight recognize this truth, and you also understand the need for action. Beyond that, you've chosen to focus your efforts on science and public health, the most enlightened and lasting way to make a real difference. Finally, you have chosen the Global Lyme Alliance because it's the best place to invest in research and education to deal with the problem of Lyme and other tick-borne diseases. By the time we get to dinner, you will have seen and heard about much of what GLA does. We so often hear from people who think we are this large national nonprofit with enormous resources. The truth, however, is that we are a small but dynamic organization, the only not-for-profit in the Lyme space with a professional staff and a team of PhDs that make things happen. And every dollar you donate is significant to us and enables us to fund cutting-edge research that gets closer to the answers we are all seeking. Up next is our opening film that will provide you with insight into the vitally important and impactful organization that is the Global Lyme Alliance. Thank you, and please enjoy yourselves.